Hello all, this is Dr. A. Ramya, Assistant Professor, Department of Pharmacology from Vistas. So today we are going to see on the topic of organization and function of autonomic nervous system. The nervous system is divided into central nervous system and peripheral nervous system. Under peripheral nervous system, it is divided into autonomic nervous system, somatic nervous system. As we know that autonomic nervous system is consists of involuntary actions, whereas somatic nervous system is consist of voluntary actions. Under autonomic nervous system, it is divided into sympathetic system and parasympathetic system. As I mentioned before, the autonomic nervous system consists of involuntary actions present in the heart, smooth muscles, the glands, and the viscera, and controls the functions of these organs. The centers for the autonomic reflexes are present in the hypothalamus, medulla, and spinal cord. Most of the autonomic activity is controlled by the hypothalamus. Most of the viscera have both sympathetic and parasympathetic actions. They have their own opposing effects and they are normally maintained in an equilibrium state. The main function of the sympathetic system is to help a person to adjust to stress and prepare their body for fight and flight reactions, while the parasympathetic mainly participate in the tissue building reactions. A man can survive and remain alive without sympathetic system if maintained stress free, but not without parasympathetic, because parasympathetic participate in the tissue building reactions which cannot be objected. The autonomic nervous system functions largely below the level of consciousness and controls the visceral functions. So now we'll see about the difference between the somatic and autonomic nervous system. So in case of the skeletal muscle, it works under somatic, where relaxation and contraction takes place and signals will be getting passed with the help of the motor neurons. In case of the autonomic, all other organs excluding skeletal muscles will be participating in the involuntary actions. Distal most synapses will be present within the CNS in case of the somatic. In case of the autonomic, it will be placed outside in the ganglia. Myelinated nerve fibers are present in both somatic and autonomic. Non-myelinated present in the autonomic. Peripheral plexus formation are absent in the somatic whereas present in the autonomic. The neurotransmitter of the somatic nervous system is acetylcholine, whereas in the autonomic it is both acetylcholine and noradrenaline. The nerve section on somatic leads to paralysis and atrophy, where the loss of movements and loss of the signals takes place, whereas in case of autonomic, activity is maintained, no atrophy. The autonomic nervous system consists of afferent, center, and the efferent. So now we'll discuss about one by one. Autonomic afferent. So they mediate visceral pain as well as cardiovascular, respiratory, and other visceral reflexes. So they are made up of non-myelinated fibers. For example, the parasympathetic afferents are carried by the 9th and the 10th cranial nerves. You can also refer the picture which is attached to the slide. So there you can see the afferent neuron which is non-myelinated and the efferent neuron which is divided into preganglionic fiber, myelinated, and the postganglionic fiber which is non-myelinated. So the junction present between them is the ganglion. The postganglionic fiber will be attaching with the receptor and connected to our organs. The central autonomic connection will take care of the breathing rate, heart rate, and digestion. In case of the autonomic efferent, they are divided into sympathetic and parasympathetic division. So in case of the parasympathetic division, the postganglionic fibers are short. The preganglionic fibers are long. The sympathetic efferent extends from the first thorax to the second or third lumbar segments, T1 to L3 of the spinal cord. So in this slide, I attached a picture which is going to say about the different nervous system and producing a neurotransmitter which is going to act on the specific receptor and produce an effective actions. So here N denotes the nicotinic, M denotes the muscarinic receptor, alpha denotes the alpha adrenergic receptor, beta denotes the beta adrenergic receptor. So here the somatic nervous system, where the neurotransmitter is the acetylcholine. So the signals getting received in the motor neurons, and due to this acetylcholine is getting released from the neuromuscular junction. So this will act on the nicotinic receptor, which is going to do the contraction in the skeletal muscles. In the autonomic nervous system, according to the parasympathetic, so here the acetylcholine is released, binds to the nicotinic receptor and also the muscarinic receptor. In the sympathetic, the acetylcholine is released, binds to the nicotinic receptor, adrenergic is a major, so noradrenaline is also released and binds to the alpha and beta receptor. And also this acetylcholine binds to the nicotinic. Cholinergic is a minor here. So here the acetylcholine binds to the muscarinic receptor. Also this acetylcholine binds to the nicotinic receptor and it directly releases the adrenaline in the bloodstream. So due to the neurotransmitter attaching itself to a specific receptor, many actions are being taking place. In case of heart, it depresses the SA node and reduces the heart rate. In the blood vessel, vasodilation takes place so that BP falls. In case of the visceral organs, peristalsis is enhanced, sphincters are being relaxed. The detrusor contracts and the sphincter relaxes, which promotes urine in the urinary bladder. In the eyes, the intraocular pressure falls and drainage of the aqueous humor is facilitated. In the glands, the secretions are promoted. So now we'll see the difference between sympathetic and parasympathetic division of the autonomic nervous system. So the origin of the sympathetic nervous system is dorsolumbar, T1 to L2 or L3. Parasympathetic, craniosacral, 3rd, 7th, 9th, 10th, S2 to S4. So in case of the sympathetic, the distribution is wide. In parasympathetic, is limited to head, neck and trunk. The ganglia is away from organs in case of sympathetic. In parasympathetic, on or close to the organs. The post-ganglionic fiber is long in the sympathetic and it is short in the parasympathetic. The pre and post ganglionic fiber ratio is also given here. So for the sympathetic is 1:20 to 1:100. For parasympathetic it is 1:1 to 1:2 except in enteric plexus. The neurotransmitter of the sympathetic is noradrenaline, which is major, and acetylcholine is minor. For parasympathetic it's only acetylcholine. Stability of the neurotransmitter in sympathetic, in which the noradrenaline is stable and diffuses for wider action. In case for the parasympathetic, the acetylcholine rapidly destroyed locally, as the acetylcholine get hydrolyzes into acetyl and choline junction. So the effect of action of the drug is lesser than the sympathetic nervous system. The important function of the sympathetic is tackling stress and emergency. For parasympathetic, digestion of food, assimilation of food, conservation of energy, even secretions of glands is also the main important function of the parasympathetic. Thank you. Hope you all understood the topic on organization and function of the ANS.